My name is William Newman, and I have been in private practice as a licensed clinical psychologist for 35 years on the North Shore of Boston. Before that, I was a licensed clinical social worker for 5 years. And I've had the privilege of learning and applying AIT over the last 2 years with joy over the efficacy of symptom relief and causal relief. AIT works rapidly, it works thoroughly, and it works deeply as it relates to the suppression and repression of painful emotions and associated negative and limiting beliefs that are attached to the emotions of people who have suffered any trauma, especially in complex childhood and developmental trauma. And because it works so well in those ways, the patients whom I've treated have been able to alleviate the duration and intensity and frequency of the symptoms of the emotional pain rapidly. And then the associated behaviors subsided, such as the obsessions, the compulsions, addictions, and dissociation. And with patients who developed fight, flight, or freeze symptoms, they were thoroughly and rapidly able to alleviate those symptoms with the application of AIT. The painful emotions and associated beliefs of trauma can cause a reactive interplay dynamic between the hypothalamus and the pituitary gland and the adrenal glands. It's called the HPA axis. And there may be an association to an event presently that evokes the painful traumatic memory that begins with the hypothalamus reactivity that signals the pituitary gland with the secretion of ACT. Then that creates a signal to the adrenal glands and the adrenal medulla, which secretes the cortisol. The cortisol is what can suppress and affect the immune system, which leads to multi-causal illnesses, especially autoimmune disease. And one example of the success of using AIT with a patient who suffered early childhood developmental complex trauma is a man who came into treatment with me about 12 years ago, complaining that he's been to multiple doctors in well-known hospitals in Boston, none of whom could diagnose or treat his symptoms of bleeding from his gums and extreme pain that was unceasing for a duration of 12 years. He came back to see me this year because he said after 12 years and going to so many doctors, it couldn't be diagnosed until he became encouraged that one doctor said, this may be an autoimmune disease. And I said, well, you have all the symptoms of it because it hasn't been diagnosed and none of the treatments have worked. Would you like to use AIT as a treatment of the trauma symptoms that you started to treat with me 12 years ago? He agreed to do it, and we treated his childhood trauma that occurred as a young child at age 5, when he experienced being smashed in the face with a brick that traumatized him so severely that he went throughout his childhood and adolescence with anxiety, avoiding the bullies growing up in Boston. And after approximately 2 to 3 weeks, the symptoms began to subside, the bleeding subsided, the pain subsided, the frequency and duration of both the bleeding and pain sustained in a reduction throughout the treatment. He was developing optimism, and a depression that he suffered from hopelessness, helplessness, and despair, which led to suicidal ideation, even at times with plans for suicide, extinguished. And with the hope, he was motivated to continue the work more frequently than he had when he dropped out, when he originally came in. And the prognosis continues to be good since the last treatment session.